Okay, today we're going to be just simply going over the flow of blood through the heart. And it's really important that you understand how the blood goes through the heart to understand how the heart itself works. You always start at the vena cavas. There's a superior vena cava and an inferior vena cava. And both vena cavas, the biggest veins of your body, dump into the right atrium, into the first receiving chamber. Then from that right atrium, blood goes to the right ventricle, and it has to pass through the tricuspid valve. In the right ventricle, this is a discharging chamber. Blood is discharged out of the heart to the lungs. This whole right side of the heart is blue because the blood is low in oxygen. So it has to go to the lungs to pick up some oxygen. Before it enters the lungs, it's got to pass through a valve. This is the pulmonary semilunar valve. It's got to travel through this large tube, which we call the pulmonary trunk. You see I've highlighted the pulmonary trunk very well. And then that pulmonary trunk splits into a left and right pulmonary artery. Now remember, an artery is a vessel that takes blood away from the heart. The pulmonary artery is the only artery in your body that's low in oxygen. All other arteries in your body are high in oxygen. Okay, once blood's entered the lungs, it needs to come back to the heart for the systemic circulation. It returns to the heart through the pulmonary veins. There's 4 of them. You've got 2 right and 2 left pulmonary veins. And I'm going to write after lungs so you can remember that this was after it's passed through the lungs. And do you notice how these vessels are red? So all 4 pulmonary veins dump into the left atrium, the second receiving chamber. And then from the left atrium, blood goes to the left ventricle and passes through the bicuspid valve. The only valve, the bicuspid or mitral valve, is the only valve with 2 flaps. This left ventricle, remember ventricles are called discharge chambers, discharges the blood out of the heart again to the rest of the body, up to the head, up to the arms, and it goes down. If you can see, it goes all the way down to the bottom over here, to the descending aorta to supply blood to your legs. Now, before the blood leaves the left ventricle, it's got to pass through another valve. This is the aortic semilunar valve. It's got to travel through this large artery right here. This is called the aorta. You've got the ascending aorta. You've got the aortic arch. And you've got the descending aorta. Okay? Then the blood goes to the body, and once it's dropped off its oxygen, it comes back and does the whole pathway again and enters the heart again through the vena cavas.